Hello and welcome. We're going to give folks just a minute here to come into the room. Thank you for joining us, and we're very eager to get started. We'll give folks until about 3:01, and then we'll kick off our material. So thanks for being here. All right, for those who are just joining us, we're just letting folks come into the room here until we see our numbers stabilize. Thanks for joining us. We'll get started here in just a second or two. All right, well, it looks like things are slowing down, so let's get started. Thank you all for being here, and welcome to our listening session. I'm Ariel Finney, WACARE's Fund Policy and Rules Manager. I'm here with Christine Kane, WACARE's Fund Policy Network Development Program Manager. We're part of the Department of Social and Health Services, WACARE's Fund team working on the rulemaking for a new chapter of Washington Administrative Code. We will only be addressing rulemaking for the Department of Social and Health Services. Employment Security Department is also doing rulemaking for the WACARES Fund program, so please reach out to Employment Security Department if you're interested in their rulemaking activities. In Chapter 50B-04 RCW, qualified family members can be paid as individual providers through a home care agency or through a third option. We're here today to discuss the third option, which we're calling eligible relative care. We will ask for public input on foundational questions for drafting language for a new option for Washington Cares Fund beneficiaries to pay qualified family members for in-home personal care. We are still early in the process for drafting and looking to learn from each of you today to help guide the material we are creating. This listening session is in relation to two CR 101s, which were filed in January of 2024 with the Code Revisor's Office. The topic we will be discussing today is a subcategory of approved services and provider registration and minimum qualifications. For those of you who are new to the rulemaking process, a CR 101 provides notice to the public of intended rulemaking. A CR 102 is when the department files draft language for public comment before finalizing the language through a CR 103. We're still at the CR 101 step and working towards our draft language for CR 102. This listening session is the first specifically for eligible relative care. We expect there will be more opportunities to provide ideas and feedback, so please look for future announcements for more rulemaking engagement opportunities. We are recording today's session and we'll make it available on the WACARES website. Please share this information with those you think will be interested. I'll provide information at the end of the session on how to submit comments for those who wish to outside of the live meeting. Our agenda for today is up on the screen. We'll follow a similar cadence to past listening sessions, where we'll cover some housekeeping items, we'll review common terms to ground our language, and then I'll pass the presentation to Christine Kane to provide some foundational information for our discussion. Christine will introduce us to eligible relative care, our current state for personal care services, and information on our vision for future state. We'll use the remaining time for our discussion. This session is scheduled for an hour and a half. We may end early if the discussion is complete. If we need more time or we do not cover all the material today, we will conduct another session to cover the remaining material. So before we begin, I want to cover a few key housekeeping items for our Zoom environment here. The Q&A or question and answer feature is available for questions throughout the presentation today. We will do our best to address questions as we go, but please be patient if your question is not answered live. We may need to follow up with you outside of the session if we're unable to incorporate the question during the session today. Chat will be disabled during the presentation, but it will become open when we begin our discussion prompts. And the recording of this webinar and the slide deck will be available on the website on the screen. I will share this link in the chat at the end of the presentation. Please allow us a few days to process the recording and post it to our website. All right, let's cover some common terms. While we do our best to explain terms as we go, it can be easy for us to fall into using language and acronyms that are not obvious to those outside of the program. So I want to do our best to kind of set that language right from the beginning. The Department of Social and Health Services is the lead on the WACARES Fund project. This listening session is focused on the work being done with the Department of Social and Health Services. You will commonly hear the Department of Social and Health Services referred to as DSHS. Employment Security Department has a major role in this project. Employment Security Department is leading the work on employee contributions. You will commonly hear the Employment Security Department referred to as ESD. Healthcare Authority is the third department responsible for a major part of the WACARES Fund program. They are responsible for the payment system, verifying use of benefits, and establishing criteria for payment of benefits to providers. You will commonly hear the Healthcare Authority referred to as HCA. Long-term services and supports, or LTSS, refers to a variety of services and resources to assist people who experience a long-term disability to maintain their safety and comfort. The Revised Code of Washington, or RCW, refers to our statutory language, which is the language enacted by the legislature. These are the laws that provide program direction, limitations, and grant permission to state agencies for rulemaking. You've already heard me use the term Washington Cares Fund, or most commonly WACARES Fund. We tend to use those interchangeably, but I think our language defaults back to WACARES Fund. You may also see WACARES Fund or Washington Cares Fund referenced as WCF. Washington Administrative Code, or WAC, are rules developed by government agencies to implement policies and procedures as delegated by the legislature. You may also hear WACs referred to as rules or regulations. And that is really why we're here today, because DSHS is looking to create rules for eligible relative care. Some terms that we're going to be using today that is specific to this eligible relative care subject starts off with Consumer Directed Employer, or CDE. And this is the legal employer of individual providers in the state. The consumer is the managing employer of individual providers and retains the primary right to select, dismiss, assign hours, and supervise the work of one or more individual providers. The state's contracted CDE is Consumer Direct Care Network of Washington, or CDWA. An eligible beneficiary is an individual who has met the contribution determination and has been determined functionally eligible based on the care needs assessment. Eligible relative care means assistance with activities of daily living and instrumental activities of daily living provided in the care recipient's home by a qualified family member who meets long-term care worker requirements. This is commonly referred to as the third option. Long-term care workers, or LTCW, are people who provide paid, hands-on personal care services. And personal care means physical or verbal assistance with activities of daily living and instrumental activities of daily living provided because of a person's functional disability. So with that, I'm going to turn it over to Christine Kane to kick us off here with eligible relative care. Thank you.
All right, thank you, Ariel. Hello, everyone. All right, well, let's just dive right in and get started talking about eligible relative care. Next slide, please. All right, so we're going to start out with the statute that really opened the door for us to explore this third way for beneficiaries to receive personal care. So we've got RCW 50B 04070, and it states that qualified family members may be paid for approved personal care services in the same way as individual providers through a licensed home care agency or through a third option if recommended by the Commission and adopted by the Department of Social and Health Services. The next statute here goes on to define qualified family member, which is a relative of an eligible beneficiary qualified to meet requirements established in state law for the approved service they provide that would be required of any other long-term services and supports provider to receive payments from the state. So with that, in July of 2024, the Commission's Minimum Provider Qualifications Work Group recommended to the full LTSS Commission that the development of this third option be deferred to DSHS, and that motion was passed. So once DSHS had confirmation from the Commission that a third option was to be developed, it was decided to title this new service Eligible Relative Care, which was already an approved service listed in WellCare's statute, just had not yet been defined. It's kind of how we came about to eligible relative care. Next slide, please. So the following 4 slides are text taken from our LTSS Commission's final annual report. And what I'm going to read through here is their recommendation for the development of ERC. So some foundational information here. Eligible relative care will be the third option for paying qualified family members for approved personal care services to be defined by DSHS through rulemaking. The foundational principles of the LTSS Trust Commission will guide the development of eligible relative care, and they are: respect the dignity and autonomy of beneficiaries in determining how and from whom they receive care, be customer focused, provide a seamless quality user experience, be accessible to all Washingtonians, both online and through a strong community presence, promote development of a long-term services and supports workforce and provider network to meet increased demand with high quality, culturally competent services. Next slide, please. Ensure beneficiaries have a broad range of services and supports from which to choose. Ensure outreach and policies are consistent with values of diversity, equity, and inclusion. Focus on solutions that are not rooted in tradition, but are tailored to delivering new program benefits and meeting needs of current and future participants. Respond to changing conditions, needs, and opportunities. Be strong stewards of worker contributions by maintaining the financial stability and sustainability of the trust. Protect beneficiaries and the trust fund from program fraud. Raise awareness of the benefit among all Washingtonians, and provide accurate data to decision makers. Next slide, please. All right, so continued here. Services are going to be personal care support. So the activities of daily living, such as assistance with dressing, eating, bathing, and med management. Instrumental activities of daily living or homemaking, such as assistance with household tasks, cleaning, shopping, meal preparation, and transportation. Excluded services include performing tasks outside of the scope of a long-term care worker, tasks that directly benefit anyone other than the beneficiary, participating in any employment or job-related activities of the beneficiary. Next slide, please. All right, and finally, the qualified family member must be a relative of the beneficiary, be 18 years of age or older, be eligible to work in the United States, pass a criminal background check, complete a 5-hour safety and orientation online training, complete within 120 days from the date of hire the training requirements under those following statutes. And that concludes the text from our commission recommendation. Next slide, please. Thank you. All right, so the following 3 slides, we're going to highlight what is either in law, in rule for walkers, or what the program has already kind of decided. all of which will impact how we design this service in conjunction with what we've just read through and has been recommended by the commission. So some things to keep in mind are eligible beneficiaries can choose to hire qualified family members through a home care agency, CDWA, which is again our consumer-directed employer, or through eligible relative care. Qualified family members will be considered long-term care workers. Therefore, training, certification, and background check rules will apply. So for relatives other than spouses or registered domestic partners, training will be 35 hours with continuing education requirements, just as it is in Medicaid. For spouses and registered domestic partners, training will be 21 hours. And again, those qualified family members must pass a DSHS background check. I do just want to qualify that regardless of which option a qualified family member works through, so agency, CDWA, or eligible relative care, the training and background check requirements do apply, provided legislation is passed to align existing family member training and certification requirements. Next slide, please. Right, and so continued on here, the WACARE's care needs assessments will not produce a care plan. So just to expand a bit there, our assessments will strictly be determining functional eligibility. They will produce like a suggested services document, but we will not be producing a care plan for folks. WACARES will have a self-directed care agreement for the beneficiaries and their caregivers. Eligible beneficiaries will determine their care tasks and how many hours they need or can afford. And eligible beneficiaries will approve their service authorizations, which will have been created by the registered WACARES provider. Next slide, please. All right, and so through eligible relative care, qualified family members are limited to providing personal care services. And just a reminder of what personal care means, it's those ADLs and IADLs. And I do want to mention here that while eligible relative care is limited to personal care, qualified family members can provide other WACARES approved services if they meet those related minimum qualifications. DSHS will not directly register or contract with eligible relative care providers. So leadership has already determined that we cannot take on the role of directly registering each caregiver under this service. So, we are looking to contract with a third party to conduct those administrative pieces to hiring a caregiver. WACARES will not have case managers. And lastly, state and federal household employee requirements apply to family caregivers when paid for personal care. So I want to take a little bit of extra time to expand on this last dot point. So for example, if we went with a direct pay model, it would mean that the beneficiary is the legal and sole employer of the family caregiver. And as such, the pay caregiver would be considered a household employee. According to the IRS, a household worker is considered an employee if you control not only what work is done, but also how it is done. And that would be the case in eligible relative care. So there's what's referred to as the nanny tax, and that is a combination of federal and state tax requirements that families must manage when they hire a household employee, such as a nanny, senior caregiver, or personal assistant. So in a direct pay model, for example, there are several things a beneficiary or their family would need to do to be able to manage the taxes appropriately. Things like applying for a tax ID, making sure they're calculating pay correctly, of course, taking care of like the I-9 and other required documents, but also submitting tax withholdings to state and federal agencies if required. I think something noteworthy here is in that direct pay model, should taxes be done incorrectly or not at all, the beneficiary would be responsible for owing the IRS. And just a bit of trivia here that I found in doing this research, the IRS estimates the average family can expect to spend 50 to 55 hours per year correctly managing this nanny tax process. So just considering all that, we want to have a model that does not require families to, pay out of pocket, whether that's monetarily or with time and resources to figure out this complex process on their own. Not everyone would be able to do that, and we do ensure equitable access to the service.
Christine, your audio was cutting out there for that last part. Would you mind
Oh
repeating
no,
that?
sure.
Thank you.
With the okay, so considering all that I reviewed that hopefully everyone caught. We we want to have a model that does not require families to pay out of pocket, whether monetarily or with time and resources, to figure out this complex process on their own. Not everyone is going to have the ability to do that, and we want to make sure we're creating something equitable in the service. Hopefully that came through okay. Next slide, please. Right. So let's transition into kind of the current state of caregiving in Washington State. Next slide, please. So I want to start by kind of painting a picture of who the unpaid family caregivers are in Washington. So we've got a couple set of statistics here from a couple different entities that I'll go through. So according to AARP, there are approximately 820,000 unpaid family caregivers in Washington State. The next two percentages here that I got from AARP, they are national statistics. I want to just preface with that, but I have worked, I connected with our family caregiver support program, and they've assured me that most national data does mirror our state quite closely. So just a preface there. So 61% of unpaid family caregivers are employed, with AARP finding that 60% of that 61% are working full-time, and that 95% of family caregivers will use their own money toward caregiving expenses at some point. The next set of statistics here was from a 2022 Center for Disease Control study specific to our state. And they found that almost half, around 45% of our family caregivers are over the age of 50 and are mostly women. And that 75% of family caregivers provided care for 6 months or longer. So again, just a bit of a background. You can find a ton of information online if you're curious, but just a bit of information on who our unpaid family caregiver is in Washington that this service may benefit. Next slide, please. All right.
Christine, we continue to have a little bit of challenges with your audio coming and going. If you are connected to VPN, would you mind disconnecting that real quick?
I'm not connected to
Okay.
VPN.
Okay. We'll
Oh,
continue on then and see
I
if it
am. I
resolves.
never do that. Okay, one sec. So sorry about that. Okay. Hopefully that's better. I was connected. I didn't realize I was. I don't typically like to be. Okay. All right. So let's move on here to looking at how our two existing options for receiving personal care work right now. So you'll see we've got a column here for home care agencies and for the consumer directed employer, which again in our state is CDWA or CDWA. And I'm just going to kind of go through this. So primary funding for home care agencies is either private pay or Medicaid. With the CDE, it's strictly Medicaid. The employer of record for a home care agency is the agency. Same with the CDE. They are the employer of record. Do home care agencies employ family members? No, they do not. The CDE does employ family members except for spouses. And then who has care planning responsibility? We've got under the home care agency, or for private pay, it's the home care agency. And for Medicaid, it's DSHS or the Area Agency on Aging case manager. And for the CDE, it's just the DSHS or Area Agency on Aging case manager. So for who's providing direct supervision of a caregiver, for home care agencies, it is the home care agency. And for the CDE, it is the client. Who authorizes hours and payment? So under the home care agency model with private pay, that's the family or the client. For their Medicaid folks, it's the case manager. And for the CDE, it is just the case manager. And then we've got, lastly, who pays the caregiver, the home care agency, and the CDE. Next slide, please. Hopefully my audio is improved. So here we have how they work with WalkCare's integrated, and I've highlighted the differences in red here. I'll just focus on those for this slide and not go through each item again. But so with WalkCare's, home care agencies will be able to employ family members, including spouses. And under the CDE, they'll also be able to hire spouses with WalkCare's. For care planning responsibility, the difference here is just under the CDE, and that will be self-directed by the beneficiary. And then who authorizes hours and payment. So you'll see in both options there, that will be the beneficiary.
And Kristen, we are still having some challenges with your audio coming and going. Would you mind repeating the slide for us?
No, I would not mind. I wonder.
Okay, thank you.
Okay. All right, so this
You
slide.
might turn off your video and see if that helps at all.
That's what I was going to suggest,
Yeah.
if that was okay. Okay, I'm going to do that. Thanks, B. Okay. So on this slide here, we've got how the two existing options for interpersonal care are going to work with WalkCare's integrated. And I'll just focus on the differences that you'll see are highlighted in red. So home care agencies will be able to employ family members, including spouses. And for the CDE, they already employ family members, but under WalkCare's, they will also be able to hire spouses for beneficiaries. The care planning responsibility under the CDE will be self-directed by the beneficiary. And then finally, who authorizes hours and payment? You'll see under WalkCare's here that is going to be the beneficiary themselves. Next slide, please. Okay. All right, so we've covered a lot of ground already. Let's move into, what this new personal care service may look like. What's our future state? Next slide, please. Right, so as mentioned earlier, we will be looking at contracting with a third-party entity to administer the employment-related activities so that those are not left to the beneficiary or their family, such as in that direct pay model I'd kind of gone over earlier. So here is what we know will be required of the entity that we contract with. So this entity must ensure that all employment taxes are paid appropriately. They must be the liable party for any unpaid taxes, ensure compliance with wage and hour laws, ensure adherence to the program's training and background check requirements for the caregivers. So again, those are the things that we know we're going to need to have from this third party to support us with this. Next slide, please. So here we've got options that could be built into the service. So things that we could require of this entity to provide. And I'll start out with some things that could be optional for the beneficiary. So they could receive support overseeing their care. The beneficiary could either be the legal employer of the family caregiver, or they could be in a joint or co-employment relationship with that employer entity. And to expand on this second dot a bit, so usually in a joint employment relationship, the entity is more involved in the client caregiver relationship. Just they're carrying a bit more liability and responsibility for the caregiver as their employee. So things like making sure that the employee can follow the care agreement, provide the tasks that the beneficiary needs, managing health and other employment-related benefits that they may be required to offer. So just a little more work on their part. Whereas if the beneficiary is the legal employer, the caregiving relationship is really going to stay between the beneficiary and that family caregiver. The entity, isn't going to have to manage health benefits, pay time off, things like that. But they would remain the responsible party for unpaid taxes. So those are some things to consider there for the beneficiary as options. For the family caregiver, they could have access to health insurance benefits. They could be offered paid leave and holiday pay. They could have the right to unionize, and they could have workers' compensation through L&I taxes being required. Right. So as we kind of move into the discussion portion, please consider, these options that you might want to see in eligible relative care. Keeping in mind, we'll want to think about, what are the appropriate or needed services that we think balanced with the benefit amount our beneficiaries will have. So just understanding that minimal involvement, from a third-party administrator will keep the rates lower. Conversely, the more involved we require an entity to be with the beneficiary and their family caregiver, the more the services might cost. So just some things to keep in mind. Next slide, please. All right, so to conclude this portion of the presentation, I'd like to highlight a few of the foundational principles that seem relevant as we move into the discussion following this. So I'll just read again a few that we'd like you to think about as we discuss further. Respect the dignity and autonomy of beneficiaries in determining how and from whom they receive care. Promote development of a long-term services and supports workforce and provider network to meet increased demand with high-quality, culturally competent services. Next slide, please. Focus on solutions that are not rooted in tradition, but are tailored to delivering new program benefits and meeting needs of current and future participants. Be strong stewards of worker contributions by maintaining the financial stability and sustainability of the trust, and then protecting our beneficiaries and the trust from fraud. And with that, I will turn it back over to Ariel.
All right. Thank you so much, Christine. And for those who are also sharing some of our challenges with the audio coming and going, we will have the slide deck available on our website. And with that, we will also include the notes. So you'll be able to catch up on any information that maybe had been missed as the audio was jumping back and forth. All right. Well, thank you all. We're about to start the discussion section of our listening session today. To participate in the discussion, please use the chat feature or raise your hand to ask to be unmuted. I will unmute you based on the order hands are raised. We do ask that you limit your time to about 2 minutes for sharing. That way we can make sure everybody's being heard and we also have the opportunity to get through all of our questions. So we will be transitioning into our discussion. With that, it looks like before we begin, we have 2 hands up that I want to address before we start our discussion points. First, I'm going to turn to Peter. I'm going to work my magic here and allow you to come off mute. So you should be able to talk.
Super. Thank you. All right. So I'm representing the Home Care Coalition, and we have serious concerns about the third option. We feel it could ultimately cost taxpayers more money, increase costs to the state's Medicaid system, and does not contain needed safeguards for consumer protection and risk to the state. It was our understanding that WellCares was going to make use of the services and supports already in place, so infrastructure and additional bureaucracy would not have to be created. We already have two mature and well-planned options, which have been in existence for 45 years. Adding a new third option would necessitate creating additional infrastructure. An argument could be made that the third option was already tried in the early years of home care and found to be problematic, which spurred the creation and development of the other two options that we have currently. The two options for in-home personal care, option one is using a home care agency if the consumer doesn't want to manage all the elements of hiring, managing, paying employees, etc., training. And second option is to utilize CDWA if the consumer wishes to do all those things, although CDWA still manages payroll, benefits, FLSA, and associated requirements. There's currently no third option for a consumer who desires to manage all those aspects and well as manage the aspects that the CDWA already does. And we're concerned that the additional costs in creating the infrastructure will be paid by everybody. CDWA and many private employers contribute to a healthcare trust. And we're concerned if third trust is allowed, we may see significant impacts of adverse selection. So people who could manage and supervise their employee but did not need health insurance would choose the third option. Those who wanted to but needed health insurance would choose CDWA, and this could drive the cost of healthcare up via adverse selection for the tens of thousands who are currently insured through the healthcare trust. And pressure would be to backfill this increase will be placed on the Medicaid system, who funds the trust via the Medicaid rate. And I would say that a version of the third option was already used in the state in the early days of home care. There were significant problems identified, as noted in the January 1981 report by DSHS that was authored by Terry Denton, Deanna Cruz-Rankos, and others. And they said, quote, prior to 1979, Shore Services operated under the individual provider program in which the client functioned as employer. This program posed two major problems. First, many frail elders found it difficult to act in the capacity of employer. And second, the program could not be monitored efficiently. And as a result, they created agency home care. And then in 1997,
Peter, I'm going to ask you to start closing your comment. We have a long line here, but plus a whole bunch of discussion to come. So thank you.
I will close it by saying in 1997 we had one of the worst abuse cases in the entire country, and from that there were more things put in place to control the IP system. So just to kind of summarize all the work that we've done on these systems, we're just going to go back to 1979 and we're not going to have any controls. And our concern is it's just not safe and it's going to drive up costs. Thank you.
Wonderful. Thanks so much for sharing that information with us. I think that's very helpful to hear, but I am going to also remind folks that right now we are focused on this third option because of the recommendation for the commission. So I do want us to continue to engage with this discussion, knowing that we are tasked by the commission to come up with some option here. So thank you for bringing that up. I'm going to move on to our next person here. I am going to limit our general comments here because we do have a lot of discussion that has some really important pieces here that we want to hear from you specifically on. But I'm going to turn it over to Melissa next, and you should be able to unmute now.
Oh, thank you. My name is Melissa Watts, and I am a parent provider for one of our state's most vulnerable adults. He's 40 years old, and I've been advocating for him and other people in his situation for a long time. I am also a proud member of SEIU 775. I'll just say that. It has taken us a very, very long time as caregivers to iron out all of the protections that caregivers need. A household is not a friendly workplace. And while it is laudable that you've gone on and talked about the inequities of family caregiving, it's also true that none of the people that we're talking about that are going to be using the Washington Cares Fund are in that group, because it is only people that will be onboarded due to their need to access the Washington Cares Fund that will be the people that'll need caregiving. And I think it's wonderful that you've decided to include spouses in the third option, but the third option has some real serious protection problems for care workers. The first of which is if the client can decide how much the payment of said worker is, that seems a little bit up in the air. I mean, to just say, oh, you're going to save a whole lot of money by paying your caregiver $1 a day is not an okay thing. Caregiving is a profession, and you have to meet certain standards to be able to provide care for someone. I'm happy that there's a training program that's going to be specially carved out. That's wonderful. And there are many aspects of that program that sound like they would be a good addition to existing choices. But the fact that people will not necessarily be protected by worker compensation, and if you're the caregiver and you gank your back, you need to have somebody that you can call and make sure that you get the care you need. Putting people in the position of being a paid care provider makes them vulnerable as well. And I, as someone who does that daily, and know that it's not, even the ADLs are not just straightforward. That's a silly notion. So it's really important that if we're going to be putting in place an infrastructure that we're going to be using this money for, we have to make sure that we put in a very thoughtful accommodation for the workers that'll be involved. The people that are, yes, they're family members, but they're also going to be working. And I just want to say, for my own opinion, that we have two, as he said, we have two very good, already existing, ironed out places where people can go. It would be good to have additional kind of an emergency training and things like that. But the idea that that would be a good thing for families is kind of silly, to think that people shouldn't be paid the money that they deserve. So I'm just going to say that I am so happy that WellCares got its mandate to continue. There's no better state to live than Washington, and we have to keep our own state working properly, because this will be a template for the future of other states as well. So
Wonderful.
thank you.
Thank you so much, Melissa. Thanks for joining here. And I certainly appreciate those comments that you've shared today. I am going to stop us here, recognizing our time and the amount of material we still have to get through. So I know we do have some hands up. You are welcome to enter some comments in the chat if you would like to, but I do want to make sure that we get to the questions we have today, because this is really where we're looking for your input as professionals who are doing this work, as people who are really invested in this material. You're here, you're ready to talk about it, and certainly the engagement is already very clear. So let's kick off our first discussion question. And my question to you all to start us off here is, what are some things that you think are currently working for the care receiver and the caregiver in our existing personal care options, which are the consumer-directed employer, or CDWA, and home care agencies? So you're welcome to raise your hand and I will unmute you. Again, I'm going to ask that folks are very mindful of their time right now. Less than 2 minutes would be ideal. But we also have the chat open, so you should be able to type your answers into the chat, and I will do my best to keep up with those. The question again is, what are some things that you think are currently working for the care receiver and the caregiver in our existing personal care options, which are the consumer-directed employer, or CDWA, and home care agencies? So I'm excited to hear from you all on what is going well. It looks like Madeline has a hand up, so I'm going to allow you to come off of mute here.
Sure, thank you. Can you hear me okay?
Yes, I
Great,
can.
thanks. Madeline Fouch, I use she, her pronouns, and with SEIU 775, representing about 55,000 long-term care workers across Washington, Montana, and Alaska. You know, I think that things working well in the existing personal care options from our perspective is we have continued to see like stronger professionalization of the workforce. I heard both from Melissa and Peter references to this, but over, the last 25 years have really gone from a place where family caregivers and caregivers broadly were considered babysitters to a real recognition that it is extremely challenging, emotional, physical labor that is happening. And that has come along with increased compensation and increased training opportunities, as well as, stronger benefits like good healthcare benefits. I will say also the right to form a union and organize are things that are working in this particular area. Not all home care agencies have a union, but all workers in home care agencies do have the right to form a union, which we think is really important in case, folks do choose to form a union and have that ability to have representation, particularly in these complex systems, and particularly for the demographics of people who are caregivers.
Wonderful. Thank you so much for sharing that. That is a great way of kicking this question off. What else do folks have to share here when it comes to this discussion about what are some things that you think are currently working for the care receiver and the caregiver in our existing personal care options, which are the consumer-directed employer, CDWA, and home care agencies? Madeline kicked us off that the professionalism of the industry has come a long ways. There are certainly benefits now that weren't there in the past, and we've heard that already today from some other speakers. So what else? What else comes to mind? I see Laura in the chat said home care agencies have improved their compliance with electronic visit verification. I'm curious to hear from folks here. We have a lot of folks in the room, so please don't be shy and jumping in the chat or raising your hand. This is an important piece for us to be hearing about what's working. What are things that are going well out there now that would be good for us to be thinking about when it comes to eligible relative care. Kate said family caregivers currently provide the vast majority of personal care outside of Medicaid, CDWA, and home care agency system. Only 1 in 20 personal care providers is part of the Medicaid system. All right, so what's working well when we think about these systems? And it sounds like maybe one of the things that is a gap within this question is that we have a lot of people who are not part of these systems, not part of the consumer-directed employer or part of home care agencies. So it's great to hear. What else? Ruth added in the chat the state family caregiver program that provides support to unpaid family caregivers. And I see Aruna, and I apologize if I mispronounce your name there. Please feel free to correct me. It asks, what does it take to become an individual provider with CDWA for family caregivers? I mean, I am not necessarily the right person to ask for that question, as that's not my area of subject matter expertise, but I bet we have some folks in the room here who may be able to assist with that.
Ariel, I can type it in the chat.
Perfect. Thank you, Bea. All right. I'm going to give us a bit more time here to think about what's going well. Katie adds in the chat, before the consumer-directed employer, management of individual provider caregiver issues was diffused across 13 area agencies on aging and many DSHS offices. When there was an issue with how the system functioned, it was nearly impossible to raise a single voice about system challenges. With the addition of the consumer-directed employer, we are able to get better clarity and action on systems issues. Okay, wonderful. So it sounds like that the system issues were easier to address with one voice. So great, or one collective voice, I guess, versus one individual person. All right. Well, I am going to give us again another second or two here. Well, more than a second, but I'm going to give us a little bit more time on this question. So if you're typing, keep typing. If you want to come off mute, please raise your hand, and I will keep an eye out for folks who want to unmute. All right, let's move on to the next question then. And if you still want to come back to this question, that's okay. We're taking comments certainly on all the questions we've discussed today, but hopefully this might kick off some ideas as well. Our next question is kind of the inverse of that, and I imagine folks may have some more comments on this one. What things are currently not working that you hope to see this third option either address or do without? And again, the question is, what things are currently not working that you hope to see this third option either address or do without? And there's two ways to engage with this question. You can put your answers in the chat, or you can raise your hand and I will give you some time to help you unmute and give you some time to speak. I see Laura has said here, more accountability for hiring deadlines and faster access to services. And Laura, would you mind confirming whether you're responding to the last question or the question up on the screen right now? Just for context here, I know it came in right as I was switching slides. Okay, perfect. So the first response in the chat here is more accountability for hiring deadlines, which is what's going well. Second, faster access to services, which is addressing our question up here on the screen. Thank you. What else? What is currently not working that you hope to see this third option either address or do without? And I see Lynn has a hand up, so Lynn, you should be able to unmute now.
All right, thank you so much. Well, I think one thing, I'm Lynn Kimball from Aging and Long-Term Care, and here on behalf of the Washington Association of Area Agencies on Aging. And I think one of the things that we are having issues with is just volume and bottlenecks that happen with training and education requirements, getting people onboarded into services. We don't have enough caregivers today. And we know for Walk Cares to work, we need to be able to easily onboard and pay family caregivers because we're really going to depend on those 820,000 family caregivers to help provide care under Walk Cares. And today in our system, we really see that bottleneck with onboarding. And we really want to see that when you add another tens of thousands of people who are going to provide care, that we're not just worsening that bottleneck, creating more stress on the Medicaid system, as well as making sure people can have easy access in new ways.
Wonderful. Thank you so much for sharing that, Lynn. That's a big help. Thinking about, again, what's currently not working. And I appreciate you coming off of mute and sharing your voice with us. I'm going to catch up here a little bit in the chat. It sounds like we have a comment about the existing systems, for whatever reason, are not supporting all the family caregivers. There are systems such as homepay.com that support beneficiaries who want to pay family caregivers. Maria added in the chat that the flip side to consolidation which was mentioned earlier, is that the scale of the system and number of issues is that they can get stalled in a queue. Another concern that we have for what's not working right now is that we don't have enough caregivers. Let's see here. It's important to remember that this is a limited benefit. We need a system that maximizes the support that family caregivers can provide. As was sharing in the chat, when I contracted Lyme disease in 2019, I benefited significantly from family caregiving when I was too sick to take care of myself. Ezra's family did not have the opportunity to access paid family care at that time. So Ezra knows firsthand the sacrifices that families may make without support and the changes that paid family caregivers make in the lives of many valued family caregivers. And family caregivers, it sounds like, are very important, just with that anecdote there in the chat. Christina shared that my hope is the third option would be administered in such a way that access to services would be enhanced for care receivers and their caregivers, and eligible spousal caregiving is key. Okay. What else? What else comes to mind when we think about, we have home care agencies, we have the consumer-directed employer, or CDWA. Those are what's currently in place. And what of those things would you think that this third option would either address or maybe do without? I see Kathy say the third option gives families a choice that fits their family's needs. All right, and I see Aruna in the chat, and again, please correct me on your name if I'm saying it incorrectly. If you want to come off mute, please feel free to raise your hand again. All right. And Kate said that there are many people getting care who are not Medicaid eligible. They hire caregivers on their own right now. All right. Let's think about that. Like, is that a system that's not working right now, Kate, or is there pieces of that? It sounds like maybe that's something that that eligible relative care could be addressing, but curious if you could share a bit more about that, about what is happening in the private pay sector there. I see Kate added the majority of people have more money than the Medicaid level. They have means to hire their own. And Laura has shared Veterans Administration benefits and long-term care insurance policies provide broader access to caregiving options, lowering administrative barriers. And Ezra shares that it's critical to recognize that caregiving is also a profession and that we're facing a shortage of home care workers in the US. And Ezra, I know I am summarizing some of your words here, but it is important. So if folks are following along, please make sure to read through all of Ezra's comments. Maria says it can take a long time to hire caregivers through CDWA, and particularly challenging for folks with limited English proficiency. And kudos to CDWA for recent process improvement efforts, but it's been a challenge hiring caregivers. All right. And Stephen shares a way for beneficiaries who at a minimum cannot perform 3 ADLs, sent off to the care of newly trained family members, and no plan of care case management. I'd like to see better services at this transition. All right, wonderful. Well, let's see here. I'm going to move us along to our next question, but please keep typing. If you're typing, please keep typing. We are certainly taking note of what is being entered into the chat here. And I do know we have some questions and answers coming in about some of the material we've talked about today and better understanding the subject. But please keep typing if you're typing, but I'm going to put this next question up on the screen just to give us some time to digest it. Our next question is, WACARES will not have case managers. What should WACARES try to account for in the design of the service, knowing there will be no case manager? And Stephen was not a paid plant in this situation here, but did a beautiful segue for us into this question, knowing that we will not have case managers. We may have some family members who are going to be new to personal caregiving or personal care and providing those types of services. What are some things that we want to account for, or that we should be accounting for in the design of the service, knowing those things? All right, Lynn, I see your hand up. I'm going to click here. It looks like you can unmute now.
Great. Thank you so much. So one thing I try to remember is every Washington worker who's paying into this system right now will be potentially eligible if you have a care need. And one thing to remember too is that Walk Cares is really being designed as a system that you have or is trying to honor your personal choice as an individual. And just because you have a long-term care need and you have a disability, whether it's due to an age or an accident, doesn't mean you've lost the capacity to make decisions. And so that's where I think it's really important to remember that this is a much broader population than everyone who is able to access care through Medicaid today. This is everyone across the state who has a need that today we're all trying to work with our family members to try to figure out, okay, how do I get my basic needs met and how do we do this? So that's where when I think about the design of this, I would just caution not to make it so onerous that it becomes a barrier to people accessing their benefit. Because we know the current system, we don't have enough people to provide care. We really need to make it, since it's only a $36,000 benefit to start, people really need to be able to get to it efficiently and be able to spend their benefit to get the care they need so they can and really honor those individual choices people have the ability to make. And for those who don't have the ability to make those choices, that's why we have other pieces to the system. And so also just remembering that, the eligible relative care is one of 3 options in the program. Thank you.
Thanks, Lynn. And thanks for bringing up those, that kind of reframing. That was really helpful. All right, I'm going to catch up here in the chat for a second, and then I'm going to go back to folks who want to come off mute. I see that Ruth has added that I'm concerned for beneficiaries who have memory issues. There needs to be some protection for them. And that is something I want to follow up with, Ruth. If you wouldn't mind expanding on that in the chat, if there's any ideas on what protections feel like they would be helpful when it comes to folks who have some level of memory impairment or impacts to their memory. I think that would be really helpful to hear more about if there's any recommendations you have there. All right, Kate said family caregivers are providing care without payer training right now. That's the vast majority of them. They are spouses, parents, other relatives. They're not professionals. They're doing what their loved one needs. Everyone who comes home from the hospital with care needs gets care from whoever they rely on in their regular lives. Only a tiny number of them are in Medicaid. Thank you for that. Seth shared, important to keep in mind that Walk Cares will cover people who are fully capable of and wanting to manage their affairs and still qualify for the program. Nicole shared a thanks to Lynn for Lynn's comment. Kathy shared their medical provider or doctor should be the person that helps the family know when they need additional care and support, not just the case manager. So looking at those other resources that may be out there beyond case management. Marguerite shared beneficiaries and family caregivers should be given the information about options, home care agencies, CDWA, eligible relative care, like the slides previously shown. This also includes the costs associated with each option. That's great to hear. It's great to hear that a resource like that would be helpful for folks trying to navigate these different options and what may be best for their unique situation. Madeline shared support for families and beneficiaries, and creating a care plan in the absence of a case manager could be beneficial. And Madeline, I'm going to ask a follow-up question of you as well, if you wouldn't mind sharing what that support could look like. When you think about support, what comes to mind there? And then Seth, seconds Marguerite's comment on including all costs, benefits, responsibilities entailed with each option detailed to the clients. Wonderful. All right. It looks like the hand that was raised has gone down, but if you wish to share, please feel free to raise your hand again. Looks like Kyle shared caregiving training, including virtual options. Okay. Christina shared an easy process for family caregivers so they can access benefits seamlessly. And Christina, I'm going to ask a question there as well. And really, for all of you, as I'm asking follow-up questions, just to kind of help us get into these details a bit more of what these could look like. But when we think of an easy process, I'm curious to hear more about that from folks who may have something in mind. What would that easy process be for family caregivers? Just to kind of get into those details a bit. Kate shared area agencies on aging help families figure out services and care needs for people across the income spectrum, not just Medicaid. Thank you for sharing that. All right, looks like we have some support for Kyle. Christina, you should be able to unmute now.
So I think when I think about easy access, I'm especially concerned about our rural counties. In our service area, we have 4 rural counties. And just making the assumption baseline that caregivers are often already stressed, how they access the service and have to navigate the system, that it's as painless as possible. And the system is built so that it's user-friendly for the caregiver or for the care receiver. And that there is support along the way, even if there aren't case managers, that there is an easy access point to help problem solve for them, whether it's around how to receive training or access the benefit. So just really designing from the perspective of the user.
Wonderful. Thanks for jumping off mute here and sharing that. That's really helpful to hear. And really keeping that user experience in mind, it sounds like will help us create a system that really supports folks getting the services that they need. All right. Well, please, if you are still typing on this question, please keep typing. I am going to move us along to our next question and let you all get a sense of that. And let's jump into it. What responsibilities would you prefer stay solely with the beneficiary when hiring their family member? And again, that's what responsibilities would you prefer stay solely with the beneficiary when hiring their family member? And it looks like Ruth provided a response to a question I asked earlier about memory issues. Ruth said, I think if a person has memory issues, another person should supervise the caregiver if possible. It is a complicated issue and rules should be developed for this situation. I suggest another discussion with professionals and caregivers and families. Wonderful. Thanks so much for following up on that question for me, Ruth. And certainly it is a complex topic. So thanks for helping me out with that a little bit. Madeline says, I think supports can range broadly, but anything from hands-on walking through what a care plan looks like to a virtual training to a template with a listen or a WATH, I'm not familiar with that, a long guide, and keeping in mind language and ability access. And Maria shared, love the idea of primary care docs helping inform family caregivers. Kathy, building the great work of GWEC, Area Agency on Aging partnerships. Wonderful. All right. So thinking back to this question, what responsibilities would you prefer stay solely with the beneficiary when hiring their family member? What comes to your mind? And it looks like we got clarification on GWEC, stands for Geriatric Workforce Enhancement Center. Thank you for that. So I learned something new today. And Kate said, if my husband were caring for me, I would not want someone else getting in the way of us getting some money to help cover his time. All right. What else? Oh, I see, Lynn, you have your hand up. I'm going to allow you to come off of mute. There you go. You should be able to come off mute now.
All right, thank you. Well, I think about for this one, the beneficiary in this program has the ultimate choice of how they would like their care provided. There is no care plan. So there's none of those guiding pieces. There's a lot more flexibility in how WA Cares was built as a limited benefit that we're all paying into. So when I think about this, it's really when I see this in the third option in relative care, if they need additional support and assistance with supervision, if they need additional support and assistance with paperwork and those pieces, that's where I see the role of going with a CDWA or a home care agency if they need supervision of that home care worker. For this option, I really see it as okay, they're willing to be independent in it. They're willing to make those choices like we do in the systems today. If we're paying privately for care and trying to manage this on our own as family caregivers, we're working with payroll companies, we're tracking our requirements, we're doing those pieces ourselves as individuals. So I would like to see where individuals can continue to have that whole responsibility for the process. And then you have other options available in the system, and it just creates more choice for individuals. I would love to see the option of even being able to use payroll companies. Maybe the state comes up with a way of what are those minimum requirements for payment and those minimum requirements for companies, just so that make sure that that individual is getting paid fairly with payroll taxes paid, but so that there's lots of different ways and lots of different access points for individuals. Thank you.
Yes, thank you, Lynn. That is great to hear that the options, the different ways in recognizing we may have different needs, all of us as we navigate this, and those needs may even change over time, but having options that could really meet the person where they're at has a lot of value. All right, I'm going to jump back into the chat here for a second, but again, if you want to participate, please feel free to raise your hand and unmute or continue to type into the chat. We're answering the question, what responsibilities would you prefer stay solely with the beneficiary when hiring their family member? Stephen said that Ruth's comment reminds me that DSH has previously talked about writing provider contracts for everyone to sign. I expect those will have language regarding powers of attorney and so on. Kyle shared, second, allowing beneficiaries to use private payroll services for paying family members for personal care. Laura said scheduling hours being included in the temporary classification for an employee, use of payroll agencies, care receiver verifying hours worked. Wonderful. And then Christina supports Lynn's comment here just a second ago. Wonderful. All right. What else comes to mind? I'll give this another, we'll maybe stay on this question for a few more, maybe 30 seconds or so. See if folks have any other comments. Kyle shared accessibility can be streamlined in a third option by allowing beneficiaries to attest compliance with employment law. And I apologize, my screen jumped there. Compliance with employment law and training. This could be enforced with audits. Okay, wonderful. Thank you, Kyle. So it sounds like there is some ideas here around kind of what's staying, but also how maybe we can be helping. Maybe there are some, some options here in thinking about things like use of payroll agencies, things like that that may be helpful for some for us to be considering. Whitney said, when thinking about beneficiaries owning the responsibilities as the hiring entity of family caregivers, I second Christina's earlier comment about ensuring there's a lot of support and information for those beneficiaries. Kate said, when I hired a nanny, my accountant provided payroll services for $150 a month. It was super convenient. It's good to know. Thank you. And Laura said something that would dovetail with portability, which is accessing family caregiver should be as easy to use out of state as it is in state. Wonderful. All right. Well, I'm going to put the next question up on the screen for us. But again, if you continue to answer that question or any other question, we will be looking through the chat again and capturing all of these ideas that are being entered here. But the next question I have for you all is, what risks and concerns do you recommend we address when implementing eligible relative care? And this is going to be for the beneficiary, for the family caregiver, or for the WACARES program. So while you're thinking about that, I'm going to jump back in the chat. Marguerite shared beneficiaries must have flexibility to use the money based upon their needs. That might mean supporting a family caregiver full-time for a short time or just a few hours over a longer period. And Nicole shared there are many professional payroll companies that exist in the state and across the country that can help get folks paid accurately and timely. Wonderful. All right. So again, we're thinking now about this question up on the screen. What risks and concerns do you recommend we address when implementing eligible relative care? Some of this we have addressed as we've gone along, but I wanted to call it out specifically as a question for you. Joe, looks like I see your hands up, and you should be able to unmute now.
Oh, thank you. Can you hear me?
Yes, I can.
Great. I appreciate that. My name's Joe Kendo. I work for the Washington State Labor Council. I have a couple of concerns about this third option, and they all sort of wrap around the notion of one, it seems to apply a fair amount of risk to beneficiaries, and two, I worry about the erosion of the workforce. And just a couple of points I'll make, and I'll be brief, and I appreciate everyone's time here. This third option seems to put quite a bit of responsibility for tax withholding and remittance obligations to elders who are benefiting from the WACARES program. And there's quite a bit of administration to navigate between the IRS, ESD, DSHS, potentially labor and industries if they opt into comp. So I do worry about the liability that would exist for something that is largely set up as an independent contractor relationship with a beneficiary. And kind of further, there's been a lot of progress. This has been brought up earlier, but a lot of progress with respect to wages and training and insurance coverage, retirement benefits, and just the general professionalization, I think is the word that was used earlier, for the workforce. And so I worry that an option like this undermines some of that progress. So I would just want to see, some kind of joint employer relationship for any kind of vendor that's acting as an intermediary, and ensure that the payroll and the tax obligations and the record keeping is kind of kept off the plate of the beneficiaries. I think with respect to the professionalization of the service, there's probably some kind of threshold that the SHS could insert, in hours per month or whatever that a caregiver is providing that, maybe accommodates the need for some of the beneficiaries who want to more or less directly employ a family member. That is less, or that is less than what might be considered, half-time or above. So in some contexts, it's quarter time, which I guess would be like 80 hours a month or something along those lines. So those are some thoughts from kind of a 30,000-foot view, and some concerns that had been triggered for me as I've been plugging into some of these conversations. Thank you so much.
Yes, thanks, Joe. And thanks for helping us gain that perspective as well, that bigger picture. As so many of us are really focused on the individual experience, it's helpful to kind of think about what risks happen from just a larger employer-employee level that need to be addressed with it as we think through this, to make sure folks are set up for success and that this doesn't have some side effects that were unexpected. All right, we have a lot going on in the chat. I am going to just jump in here and catch up. Looks like we have a risk being the people getting frustrated, getting access to the benefit. If there's too many delays and hurdles, it'll be like health insurance, which people are enraged. Whitney shares, although it's important to support client choice, without case managers, it's unclear how additional oversight to aid in prevention of financial exploitation or abuse of those benefits could occur. And that's really helpful, Whitney. Pulling out that financial exploitation or other abuse, I'm curious if you have any ideas on how to prevent that risk. I know it's not directly related to the question, but I'm curious if there's some ideas there that we could be thinking about now as we build this. Kathy shared this as a limited benefit, and most family caregivers will not want to become full-time caregivers. We have some additional thoughts on Kate's comment from before, needing to have access, but balanced with controls. We have another concern regarding some financial fraud. And Stephen, if you have any ideas on how to prevent that or what can be done there, I'd love to hear some ideas. Next up, Ruth shares some families are really overwhelmed when a family member needs care, such as after having a hospital stay. I think if we're not having case managers, we need to build some support for the beneficiary and the family. It's important to it's important to set a work plan so the caregiver is not taken advantage of and the beneficiary gets the care they need. All right, well, we have more in the chat here, but I'm going to move us to our next question, just recognizing our time and wanting to make sure we get through all of our discussion points. Please know that just because I haven't read through your comment does not mean it is not valuable and that we won't be looking at it again at the end of this presentation. But again, I want to make sure we're hearing from folks. Our next question is, what are the administrative supports that you think a family caregiver would need to get paid and to provide care? So again, that's what are the administrative supports that you think a family caregiver would need to get paid and to provide care? Some things that we're going to think about here as we think about administrative supports. Oftentimes supports come with some sort of service, and that service is going to have some level of rate. So we are needing to think about that and that impact to a beneficiary and their benefits as we add on any sort of rate. But also, because we're doing rules and we are going to have our rates in rules, we'll also need to be considering that component, that if there's an associated rate, that we are considering that for our rules, which will be another project here to come soon. So it looks like we have a hand up. Joe, your hand is up, but I'm not sure if that's a carryover from before. Okay. Maria, you should be able to unmute now.
Thank you, Ariel. This may have been, my comment may be better for the last section, but I'm not sure exactly. Could be an administrative support. To one of the comments earlier, it might have been from Lynn, where she kind of talked about for some folks, home care agencies are going to be the best option. For some folks, hiring a provider through the CDWA system is going to be the best. And then for others, it may make sense to have a family member. I'm wondering if you could develop a tool or a guide or a mini assessment to help folks kind of figure out which of those options may best fit, and that can address some of the questions or comments that came up, such as lack of a case manager or someone to guide them through this, and concerns about particularly people with memory loss and who may be at greater risk for abuse.
Wonderful. Thank you so much for sharing. And thank you also for coming off mute and sharing your voice. That I'm going to catch up here in the chat real quick. Looks like we have Seth sharing admin support. It could range from no supports, use of own resources, to full support, which is the agency. Clients should be provided with benefits and risks, responsibilities and obligations for each of the three options. Kyle shares, I think it's important to keep in mind that WellCares is not Medicaid, and the long-term care system relies on unpaid family caregivers who do not desire to become professional caregivers. I hope for a system that maximizes beneficiary choice and maximizes a limited benefit that can be a model for other states. An admin support could range from no supports, use of own resources, to full support, which is an agency. And clients could be provided with benefits and risks, responsibilities and obligations for each of the three options. And a payroll service could be easily engaged for those that need one. There's a range of experience in dealing with payroll and taxes. Think of small business owners or sole proprietors. This should be a choice for those who do not need the full services that the other options provide. And next up, we have support to navigate or get through training, background checks, and other employment eligibility requirements. Wonderful. All right. So my next question that I will put up on the screen here in a second, but I do want to throw this out there now as we're thinking about the administrative supports for a family caregiver. But what about for a beneficiary? What would a beneficiary need to get paid and to provide care? And I think some of that's already coming up as we think about the supports for family caregiver. Some of those would probably already also be helpful for a beneficiary. But I'm curious what you all think about that. And I'll put the next question up on the screen just for the visual. But what are the administrative supports you think a beneficiary would need to work with a family caregiver? So we're thinking about, at this point, both the family caregiver, what the supports they need, but also what would a beneficiary need? I'm curious what folks have to say about that. And Lynn shares, as others have mentioned, decision support tools that list out options and how to access, costs, advantages to each, and so on. Wonderful. What else? Incest shares same resources as for caregiver, but maybe additional resources of working, hiring, family. Maybe USSBA has info. And I'm curious, Seth, if you could share what USSBA stands for. Just make sure I'm interpreting it the right way. Oh, Small Business Admin. Okay, thank you. Caitlin shares a streamlined process. When we overthink and overdo these processes to try and to minimize risk, we end up obstructing access for the beneficiary. It is a fine line to walk. It's a fine balance, right? And Laura says the ability to track benefit usage on the WaCares website. Okay. Kathy shares they need to know the care options available to them and the related costs. Wonderful. And when we think about the caregiver or the care provider, and thinking about things like payroll taxes or other things that as an employee need to be accounted for, or maybe we think about this from a beneficiary side, whatever way feels best to you. What are things that need to be in place to help support people managing that? Because I imagine, as we think about a lot of the cases that we've talked about so far today around family caregivers stepping into caregiving roles, but this isn't their career path. They may not know about things here. And I know we've heard a little bit about resources and wanting that, but is there anything else there that we should take note of as we think about these administrative supports to help people manage this, working in this third option? And simplified access to technical support, helpful for beneficiaries to be easily check how much has been spent on a monthly basis, including an overhead and administrative costs. So separating that out, it sounds like. And then clear disclosure when people choose their option of what they are paying for, whether their benefit is paying for things in addition to required taxes, and a minimal administrative fee. Okay. All right. Well, folks, we are at the end of time. This has been a fantastic discussion, and it's clear that you all know so much about all the different things to be considering here. But particularly, each of you have brought your own lens into the discussion, which I think has been just incredibly valuable to not only hear your voice, to read your comments, but also thinking about all the different ways to look at these things. So please know that today is really our kickoff of this listening session, talking about these questions. But there will be more to come as we talk about eligible relative care and we think through what this will look like. I'm going to put some links in the chat here. The first one being our DSHS website, the rulemaking website for WACARES. That is where this recording is going to be posted, along with a slide deck, which will include the notes from the presentation. So if you've missed pieces, you can go back through and catch up on any information. In addition, we have Employment Security Department's rulemaking website. We have Healthcare Authority rulemaking website. You also have my email address here, which if you have comments that you didn't get a chance to put in today, or you go home and you're thinking about stuff, please feel free to send those comments over to me at that email address. Any sort of general questions about the WACARES Fund program, questions about, how does it work and what does it look like, please send to wacars@dshs.wa.gov. And once again, I want to say thank you all for being here. Thank you for your time, your attention, and for engaging in this discussion. This is something we're going to take back, we're going to be thinking about, and really letting this drive in many ways how we approach this rulemaking. And Kathy, I see a question about the written comments. You're welcome to send them to me, and that will be incorporated into our rulemaking file as we are talking about the process and thinking through it. We'll make sure to file that away. Otherwise, please make sure you are signed up for rulemaking notifications, which you can find on our WACARES Fund rulemaking website. Otherwise, once again, we're very grateful to each of you for being here today, for everyone participating. Your voice is so important. And I'm really thrilled today about just spending this time with you and getting a chance to hear from your experience. So have a wonderful rest of your day. Really appreciate you all, and we'll talk again soon.